If your doctor recently told you that your creatinine is too high, or if you've been noticing foamy urine in the morning, waking up 2 or 3 times a night to use the bathroom, or feeling more tired than usual, I need you to stop scrolling and watch this video all the way through. Because what I'm about to share with you in the next few minutes could genuinely change the trajectory of your kidney health. My name is Dr. William, and I've been a practicing nephrologist, that's a kidney specialist, for over 25 years. In that time, I've sat across from thousands of patients, many of them right here in the United States, seniors just like you who came to me confused, scared, and unsure of what to do next. And one of the most common questions I get almost every single week is this: Doctor, is there anything I can eat to help my kidneys? And my answer today is yes, absolutely yes. But it depends on what you're eating, how you're preparing it, and how much of it you're having. Now, here's what scares me about what I see on the internet. And I'm going to be very honest with you. There are a lot of videos and websites out there making wild claims. Cure your kidneys in 3 days, or drink this and your creatinine drops overnight. That is not what this video is. I'm a doctor. I take my responsibility to you seriously. What I'm going to share with you today is rooted in real science, published research, and guidelines from organizations like the National Kidney Foundation and the Mayo Clinic. No miracle cures, no exaggerations, just the truth. And the truth is powerful enough on its own. Here is what we are going to talk about: the top 5 vegetables backed by real clinical evidence that can help support kidney function, reduce the burden on your kidneys, and in many cases, help stabilize or gradually lower elevated creatinine levels when combined with the right lifestyle changes. And I'm also going to tell you something that most YouTube videos completely leave out: the preparation mistakes that can actually make things worse, even with healthy vegetables. Stay with me, because that part alone could be a game changer for you. Before we dive in, I want to ask you something. If you've been told your creatinine is above 1.2, or you've been given a GFR number below 60, I want you to comment right now below this video and tell me where you're at. Just type your creatinine number, or stage 3 or stage 4, whatever your doctor told you. I read these comments, my team reads these comments, and your story might help someone else who is watching this right now and feeling completely alone. You are not alone. Millions of Americans are managing this, and we're going to talk about it together. All right, let's get into the 5 vegetables, and I promise you, number 3 is going to surprise you. Most people think it's bad for kidneys. The science says otherwise when you know how to use it correctly. Vegetable number 1, red cabbage. The first vegetable on our list is one that almost nobody talks about in the context of kidney health. And that right there is a problem, because red cabbage might be one of the most kidney-friendly, creatinine-supportive vegetables available in any grocery store in America, and it costs almost nothing. Let me explain what creatinine actually is first, because I want you to understand the why behind everything we discussed today. Creatinine is a waste product. It's produced naturally when your muscles break down a substance called creatine, which they use for energy. Your kidneys are responsible for filtering creatinine out of your blood and excreting it through your urine. When your kidneys are working well, creatinine levels stay within a normal range, roughly 0.7 to 1.2 milligrams per deciliter for most adults. But when the kidneys begin to struggle, whether from chronic kidney disease, diabetes, high blood pressure, or other factors, they can't filter as efficiently, and creatinine starts to build up in the blood. That rising number on your lab report is a signal. It's your kidneys telling you they need help. Now, red cabbage. Why is this vegetable so remarkable for kidney patients? There are 3 main reasons, and I want to walk through each one carefully. First, red cabbage is extremely low in potassium. This is critically important for anyone with CKD because damaged kidneys often struggle to excrete excess potassium. High potassium in the blood, a condition called hyperkalemia, can cause muscle weakness, heart rhythm problems, and in severe cases, it can be life-threatening. Many vegetables that are otherwise healthy, like bananas, potatoes, and tomatoes, are loaded with potassium and can actually be harmful in higher stages of CKD. Red cabbage contains only about 170 milligrams of potassium per half cup serving. That is genuinely low. It's a vegetable you can eat without constantly worrying about your potassium level spiking. Second, red cabbage is low in phosphorus. This matters just as much. When kidneys start to decline, they also struggle to remove phosphorus from the blood. High phosphorus levels pull calcium out of your bones over time, weakening them. It also calcifies blood vessels, which is one reason kidney disease patients have higher rates of cardiovascular problems. Red cabbage gives you nutrition without loading you up with phosphorus. Third, and this is where it gets genuinely exciting from a clinical standpoint, red cabbage is packed with anthocyanins. These are the natural pigments that give it that deep purple-red color, and anthocyanins are powerful anti-inflammatory compounds. Research published in journals like the Journal of the American Society of Nephrology has shown that inflammation plays a central and ongoing role in the progression of chronic kidney disease. It's not just about filtration. It's about inflammation in the kidney tissue itself, accelerating damage over time. Anthocyanins help interrupt that inflammatory process. They don't fix what's already lost, but they may help slow down further damage. And that matters enormously for your long-term trajectory. Now, here is the practical side and the mistake I see patients make constantly. They steam red cabbage until it's completely soft and mushy. That's not ideal. When you overcook red cabbage, you significantly reduce its anthocyanin content. Heat degrades these pigments. The best way to consume red cabbage for maximum benefit is either raw, shredded into a salad or coleslaw, or lightly steamed, just 2 to 4 minutes, so it retains its color and crunch. If the color turns from purple to blue-gray, you've overcooked it. That's your visual cue. I also want to mention something nobody talks about. Red cabbage is mildly alkalizing in the body. Some research suggests that managing the acid-base balance in the blood, something called metabolic acidosis, is important for kidney patients. Metabolic acidosis can actually accelerate kidney function decline. A diet rich in plant-based alkalizing foods like red cabbage may help buffer against this. The National Kidney Foundation has noted the importance of managing acidosis in CKD patients, and dietary approaches are real evidence-based part of that strategy. One serving of red cabbage 3 to 4 times a week is a reasonable, realistic, and kidney-friendly goal. It's inexpensive, widely available, and extraordinarily versatile. You can put it in salads, wraps, soups, or as a side dish, and it is one of the cleanest vegetables you can eat if you are managing elevated creatinine. Vegetable number 2, cauliflower. The second vegetable on our list is cauliflower. And I know what some of you are thinking. Cauliflower? Really, doctor? That's your big reveal? But stick with me, because the reason cauliflower belongs on this list goes much deeper than most people realize. And there's a specific preparation method that multiplies its benefits dramatically. Cauliflower has become trendy in recent years as a low-carb substitute for rice and mashed potatoes. But for kidney patients, its value goes far beyond carbohydrates. Let's talk about the 3 pillars of why cauliflower is exceptional for kidney support. First, like red cabbage, cauliflower is low in potassium and phosphorus. A half-cup serving of cooked cauliflower contains approximately 88 milligrams of potassium and only 22 milligrams of phosphorus. These numbers are among the lowest of any vegetable you can find, which is why the National Kidney Foundation specifically lists cauliflower as a kidney-friendly food in its dietary guidance for CKD patients. When your kidneys are struggling, every milligram of potassium and phosphorus you reduce from your diet gives your kidneys a little more breathing room. Second, cauliflower contains a remarkable group of compounds called glucosinolates, which are broken down in the body into indoles and isothiocyanates. These compounds have been studied for their ability to reduce oxidative stress. And here's why oxidative stress matters for your creatinine levels specifically. Oxidative stress damages the tiny filtering units inside your kidneys called nephrons. Once a nephron is damaged beyond repair, it cannot regenerate. The kidneys are one of the few organs in the human body that cannot regenerate their functional units. So, protecting remaining nephrons from oxidative damage is not just helpful, it is foundational to any strategy for preserving kidney function. Third, and this is the point that very few people discuss, cauliflower is a significant source of choline, a B vitamin-like nutrient. Emerging research suggests that choline plays a role in reducing urinary protein excretion. That's the proteinuria, the foamy urine that many of you watching may be experiencing right now. Proteinuria is not just a symptom. So, if you want to preserve the beneficial compounds, you should crush or finely chop the garlic first. Then let it sit for about 10 minutes before cooking it. After that short waiting period, you can lightly saute it or add it to dishes without losing as much of its active allicin content. Another important point for kidney patients is moderation. Garlic is not something you consume in large therapeutic amounts without guidance. In food level use, such as 1 to 2 cloves per day in meals, it is generally considered safe for most people with chronic kidney disease, but those on blood thinners or certain blood pressure medications should always consult their physician first, because garlic can mildly enhance the effects of these drugs. And here's something worth understanding in the broader picture. When we talk about kidney health, we are not talking about a single superfood fixing anything on its own. Garlic works as part of a pattern, lowering inflammation, supporting blood pressure control, and improving vascular health over time. That combination is what indirectly reduces stress on the kidneys and may help slow down the progression of decline in people at risk. Now, let's move on to vegetable number 4, spinach. Spinach is often misunderstood in kidney discussions, and this is where nuance matters. On one hand, spinach is incredibly nutrient dense. It contains folate, magnesium, vitamin K, and powerful antioxidants like lutein and beta-carotene. These compounds support overall cellular health and reduce oxidative stress, which, as we discussed earlier, is one of the key mechanisms involved in kidney damage progression. However, spinach is also high in oxalates. Oxalates are naturally occurring compounds that can bind with calcium and contribute to kidney stone formation in susceptible individuals. This is why spinach has a controversial reputation in kidney health discussions. But it's important not to oversimplify this. For most people with chronic kidney disease who do not have a history of calcium oxalate kidney stones, small and controlled portions of cooked spinach can still be included in a balanced, renal-friendly diet. Cooking spinach slightly reduces its oxalate content, making it more tolerable compared to raw consumption. The key idea here is portion control and preparation method, not complete avoidance. A small serving, a few times per week, combined with a varied vegetable rotation, is very different from daily large smoothies or raw spinach-heavy diets, which can be problematic in higher-risk individuals. This is exactly why individualized dietary planning matters so much in kidney care. What is beneficial for one patient may need adjustment for another based on lab results, stone history, and overall kidney function. Now, vegetable number 5. Broccoli. So improving gut health isn't just a digestive issue. It directly affects how hard your kidneys have to work. The fiber in vegetables like red bell pepper helps feed beneficial gut bacteria, which may reduce the production of these harmful uremic toxins over time. That's another indirect but important pathway through which diet can support kidney function. Now, let's talk about preparation, because this is where many people lose a lot of the benefit without realizing it. Red bell peppers are best consumed raw or lightly cooked. Raw consumption preserves the full vitamin C content, which is heat sensitive and can degrade significantly with prolonged cooking. If you prefer them cooked, quick sautéing or light roasting is preferable over boiling or long stewing. Boiling, in particular, can leach water-soluble nutrients into the cooking water, reducing their nutritional density. Another practical point for kidney patients: red bell peppers are extremely versatile and easy to integrate into daily meals. They can be added to salads, sliced as snacks, mixed into omelets, or lightly cooked with other kidney-friendly vegetables like cauliflower and cabbage. This makes them one of the easiest vegetables to consistently include without feeling like you are on a restrictive diet. In terms of frequency, incorporating red bell peppers several times per week is generally considered safe and beneficial for most individuals with early to moderate kidney disease. Again, depending on personal lab values and guidance from a healthcare provider. Now we move to the fifth and final vegetable, and this one is often the most misunderstood of them all: zucchini. Zucchini is a very low-calorie, high-water content vegetable that provides hydration support, gentle fiber, and a very low mineral load compared to many other vegetables. This makes it particularly useful for kidney patients who need to manage potassium, phosphorus, and overall metabolic burden carefully. One of zucchini's key advantages is its extremely low potassium content compared to most common vegetables. This allows it to be consumed in relatively larger portions without significantly impacting potassium levels in the blood, which is a critical consideration in more advanced kidney impairment. Zucchini also contains antioxidants such as lutein and zeaxanthin, which are more commonly discussed in eye health, but also contribute to reducing systemic oxidative stress. As we've discussed throughout this video, oxidative stress is one of the key accelerators of kidney tissue damage over time. Another important benefit is its high water content, which supports hydration status without adding metabolic strain. Proper hydration helps the kidneys efficiently filter waste products, including creatinine, although it does not flush or detox the kidneys in the exaggerated sense often claimed online. Instead, it supports normal physiological function. From a preparation standpoint, zucchini is best lightly cooked, such as steaming, sautéing, or roasting. Overcooking can make it overly soft and reduce its texture appeal, but nutritionally, it remains relatively stable compared to more delicate vegetables like leafy greens. It can also be used as a substitute for higher carbohydrate foods in certain meals, such as spiralized zucchini noodles, which many patients find helpful when trying to reduce metabolic load while still feeling satisfied with their meals. When we look at all 5 vegetables together, red cabbage, cauliflower, garlic, red bell pepper, and zucchini, the common theme is not miracle healing. The real theme is metabolic efficiency. Low potassium load, low phosphorus burden, antioxidant protection, anti-inflammatory compounds, and support for vascular and gut health. But I need to be very clear with you before we end. None of these foods replace medical treatment. They support it. Kidney disease, especially in stages 3 and beyond, is a medical condition that requires monitoring, blood tests, and individualized care. Diet is one part of a much larger picture that includes blood pressure control, blood sugar management, medications when needed, and regular follow-up with a nephrologist. What these vegetables can do is help reduce unnecessary strain on the kidneys and support the body in doing what it is still capable of doing. And that is the real goal. Not reversal overnight, not miracle cures, but slowing progression, stabilizing function, and improving quality of life over time. But they still need to fit into your overall medical picture. Because kidney health is never just about food, it's about how food interacts with your medications, your lab values, your stage of disease, your blood pressure, and your fluid balance. What helps one patient at stage 2 CKD may need adjustment for another patient at stage 4. That's why communication with your healthcare team matters. Bring your diet changes, your questions, and even your concerns to your nephrologist or renal dietitian. A well-informed diet plan is always safer and more effective than trying to navigate everything alone from online information. Now, as we come to the end of this discussion, I want to bring everything together so it actually makes sense in real life, not just as isolated vegetables, but as a system. What you've seen here is not a list of miracle foods. It's a framework for reducing stress on the kidneys through 5 consistent principles: lowering potassium overload when needed, reducing phosphorus burden, supporting antioxidant defense systems, controlling inflammation, and improving vascular and gut health over time. When you combine vegetables like red cabbage, cauliflower, garlic, red bell pepper, and asparagus, or zucchini, depending on the variation, with proper preparation methods and balanced portions, you're not healing kidneys overnight. You are creating a more favorable internal environment for the kidneys to function with less strain. That distinction is extremely important because chronic kidney disease is, in most cases, a long-term condition. The goal is not dramatic reversal, claims you see online, but rather stability. Keeping creatinine from rising too quickly, preserving remaining kidney function, and reducing complications like fluid retention, high potassium, and cardiovascular strain. And I want to end with something practical you can actually apply starting today. Keep it simple. Rotate your vegetables instead of repeating the same one every day. Avoid overcooking. Minimize added salt. Prioritize whole foods over processed or blended forms. And most importantly, match your diet to your lab results, not to generic advice online. If there is one message to take away from all of this, it is that kidney support is built through consistency, not extremes. Small daily choices, done correctly and consistently, are what make the real difference over time.